Well, you've heard me talk about this before on this show. In this edition of For Your Health, talking about ovarian cancer. I had a good friend, great shape, the whole thing, and she got ovarian cancer. Luckily, we got her through it, but what a scary time that was. Nicole Sandford joins us. She's the CEO, president and director of Aspira Women's Health. And we're going to talk about the fact that 1.5 million women face ovary removal dilemmas due to a pelvic mass diagnosis, and what is it that women need to know. Nicole, thanks for coming on.
Oh, thanks for having me.
So let's talk about it. Even though it might be considered rare, it's so crucial, isn't it, to early identification? And what do you suggest that women do? What do they need to do? What is the woman's risk of ovarian cancer?
Sure. Yeah. Well, happily, ovarian cancer is relatively rare when compared to other women's health issues and women's cancers. But it is tricky to diagnose. There's sort of a myth out there that there are no symptoms, and that the truth is there are symptoms. The biggest challenge is the symptoms are very similar for other things. It's bloating, it's painful periods, things like that. So number one, most important thing women can do is listen to their bodies. If something doesn't feel right, go to the doctor or talk to the doctor about it and make sure that they do the follow-up testing that can help you feel confident that you know what you're dealing with.
Yeah, so speaking of tests, are there tests available to assess the risk of ovarian cancer?
Yes, actually there are. We have a portfolio of blood tests, which means these are non-invasive tests. Typically what will happen is you'll go to the doctor with some symptomatic issues, or there'll be a pelvic ultrasound done for some other reason, and there'll be a mass identified. And that's where the fear usually starts to kick in. But the tests that we have allow the clinician at that point to do a blood test and give you a risk score so that you can understand the likelihood that that mass is malignant. And remember, what we just said is that most of these masses will be benign. They won't be cancer. And what we've tried to do by developing blood tests that can help, understand the risk of malignancy is help women and their doctors make decisions based on data and not just based on fear.
Oh, I like that. Based on the actual data, like you say, I mean, it's so significant here. And then that way you can monitor the mass, right, instead of having surgery and deciding what is the right surgical approach if you have to do it.
Right. Well, yeah, there are lots of reasons why you may want to go ahead with the surgery, even if the risk of malignancy is low. So, it won't eliminate the need to have surgery for pelvic mass completely. However, it may help you to decide when you would want to do a surgery, first of all. And ultimately, we do believe that when people adopt a test like our Overwatch test, which is used in initial clinical assessment, there will be fewer surgeries done sort of as a preventative measure, because you'll have a really good sense of the likelihood that you're dealing with a malignancy, and you might take a watchful waiting approach for some time. And if it's a benign mass, sometimes they just resolve themselves.
Wow, good to know. All right, so where can people go for more information about you, your company, and what we're talking about?
Yeah, so you can learn all about Aspira and our tests at Aspira Women's Health's website, www.aspirawh.com. And you can also reach out to us through the website to find a physician in your area that is familiar with the test.
Oh, that's great. Great resource for sure. Nicole Sandford, thanks so much.
Thank you.